critically important that we keep the patients and the staff safe. And we know it can be a little scary to come into a hospital right now. So as we're welcoming more patients back for inpatient visits this week and moving towards more surgical procedures, we've taken a number of steps to make sure it's safe for everybody. First, universal masking. Everyone coming into our clinical facilities now, staff and patients, are wearing masks. Second, we're continuing to observe that physical distancing, so space 6 feet between people to help keep us safe. We have self-attestation for all of our employees every day. They need to tell us that they have no new symptoms. And if any of our employees have any symptoms, they need to stay home and they right away have access to testing. We are also testing all surgical patients and all inpatients coming into our facilities. So for COVID positive patients, we can keep them in a safe but separate spot. During the first part of this response to COVID-19, we kept our clinics open for those patients that needed to be seen urgently, but at the same time, we switched everything that was possible to telehealth. And with that, we have greatly expanded our services available to telehealth. So we now have over 1,200 providers privileged, and last month we did over 14,000 visits via telehealth. This is great news for our patients because it means going forward that we can now continue to use telehealth visits when it will work. We continue to stay apprised of the latest developments and see how they need to modify our practices to continue to be safe for our patients and our staff. So we have experts, UW Medicine experts that help us in infectious disease, virology, and other specialties, and they help advise us while we continue to work with state and federal agencies such as the King County Department of Health, Washington State Department of Health, CDC, and World Health Organization. One of the first things we're doing here is we are offering this to all UW Medicine staff. And the reason is we want to study the prevalence of antibodies in a large group, such as our staff, and particularly with healthcare providers. So this will help us know more as we all move forward with understanding what exactly do the results of antibody testing mean. We're lucky that we have the UW Medicine Virology Lab in our system. So we are able to have blood draws for our staff in our patient care facilities and process these specimens right here in the UW Medicine Lab.